The CDC reports preventing childhood trauma could reduce the number of adults with depression by more than 40%. News 2's Haley Wilgis looks into the long-lasting health effects of adverse childhood experiences and how families can break the cycle.
As a great-grandmother, Shirley Jones wasn't expecting to be raising a 10-year-old, but she stepped up to the plate when she took temporary custody of her great-grandson about a year and a half ago.
You don't raise this generation the way I was raised. Today, kids want to be listened to. You have to listen to the kids to understand what they're dealing with.
Jones started to see that her great-grandson was dealing with some things, and she wanted to understand how she could best help.
He used to throw things and claw at his face and do some things that were not normal things for a 10-year-old. He's upset. I'm getting upset. That was not going to solve the problem. So I knew we both needed some help.
Jones's caseworker got her connected with Tennessee Voices, a nonprofit organization that provides counseling and other mental health resources for children and adults.
I don't think people realize how vulnerable children are. You take a child from a familiar environment and put them somewhere else, that's challenging for children.
Like Jones's great-grandson, a child being placed in a different home can be considered an adverse childhood experience, or ACE. Tennessee Voices CEO Ricky Harris explains.
ACEs can be anything from divorce of your parents, loss of a caregiver, an incarcerated parent, people using drugs in your home, abuse for sure.
A landmark study published in 1998 by the CDC and Kaiser Permanente linked adverse childhood experiences to an increased incidence of mental and physical health problems. Decades of research since has strengthened the findings. People who reported 4 or more ACEs had a 4 to 12-fold increased risk for alcoholism, drug abuse, depression, and suicide attempt. ACEs can also increase the risk of heart disease, diabetes, and cancer. Toxic stress from ACEs can alter brain development and how the body responds to stress.
We definitely focus on our work with children, especially those who've experienced trauma, because we know that the sooner it gets addressed, the better the long-term trajectory is for a child.
Harris says unaddressed ACEs can affect your parenting, so even if you didn't receive counseling as a child, it's not too late to start now.
And I've seen families really come full circle when willing to address that generationally going forward, stops a cycle of things that it's just a beautiful picture when you actually address those traumas.
Our relationship is much better. He opens up to me more, and we enjoy being around each other more. And I thank God to this day that I realized that, and I sought some help. And I don't feel any shame.
Jones and her great-grandson, now an honor roll student, both received counseling services. She hopes other families will see reaching out for help as a sign of strength, not weakness. Haley Wilgis, News 2.